Hello, my name is Hidayah, and today I'm going to do a post-operative chart for varicose vein case history. So on my screen here, I have provided a chart that contains all the information required for the patient's post-operative monitoring. And this includes the patient's ID, which is the name, the date, the time of monitoring, objective and subjective examinations, urine observations, and etc. So the patient had surgery of ligation of saphenous femoral junction, also known as cystectomy, on the 20th October that started at around 10 a.m. and ended around 1 p.m. So the patient is then transferred to the patient ward for further monitoring. And right after surgery, I will be taking a complete blood count to assess their hemostatic system. And this here is the result. So you can see that the patient's hemostatic system has improved when compared to before the surgery. So during the first hour, the patient will be monitored every 15 minutes, and then starting from the next hour, he will be monitored every hour and then. So the changes to expect from the patient right after surgery is swelling of the lower third of ankle and foot, and moderate pain, bruises or redness on the site of varicose vein evacuation, and there should be no bleeding or pus. And at 1 p.m., right after surgery, the patient's vital sign has been assessed, and the results were all as expected. During the first hour, patient experienced moderate pain on a scale of 5, so we have given him ibuprofen to help ease the pain. And at the same time, heparin is also given twice per day to help prevent the blood clotting. So the swelling of the leg can be seen during the first few hours, but fortunately it decreased gradually during the day. And we have inserted polycatheter throughout the entire duration of the patient's stay in the hospital. Again, patient is given a balanced, nutritious meal like boiled meat and vegetables to promote healing of wounds. And during the day, the patient's leg will be elevated from time to time to further prevent formation of thrombosis. The patient is contraindicated in doing strenuous exercise right after surgery because he has to rest for the rest of the day to promote healing of wound. And so the monitoring for the first day ended at 12 a.m. where the patient's vital sign has greatly stabilized. Now going on to the next day, we began monitoring at 6 a.m. Now the patient no longer feels pain, so we did not give him any more painkillers, but heparin is still continued. It's important to note that heparin is going to continue for 1 week to prevent formation of blood clots. So the same routine is being done here, and the only difference here is that we will monitor the patient every 4 hours since the patient's vital signs are normal. And meal is given 3 times per day with snacks in between. Again, his leg should be elevated from time to time, and don't forget to mention that patient should wear compression socks the whole time during the day. On the second day, I have also taken another blood test to monitor his hemostatic system, so we can see that everything here is normal, which is a good sign. And because of that, on the third day, over here, again, the same routine, monitored every 4 hours. And because, according to his lab tests, his hemostatic system is normal and his vital signs are also normal, I would discharge him at around 1 p.m. But before that, I would inspect the wound area and change the dressing. And after that, I will discharge the patient at around 1:45 p.m. That's all. Thank you.